with the steward. It's Martin and Ms. Martin. Today we're going to teach you, give you all some insight on sexually transmitted diseases. Okay. How many sexually transmitted diseases are there? Anybody know?
About one.
Pardon me?
About 110 of them,
You can name off, what, 7 for me?
Let me see, hepatitis B, hepatitis C, syphilis, gonorrhea, AIDS, STDs, HIV. That's the only 7 I know.
Okay. Which, what did you think is the most common one in high school children?
In high school?
HIV.
Gonorrhea.
HIV. Among school-age children within the Bahamas, what age group is affected the most?
The teens.
I would say 12 to 16. 12 to, yeah, 16 to 16.
12 to 18.
How can a person contract an STD?
By sexual intercourse.
Okay, what is a sexually transmitted disease? Sexually transmitted disease, STD, also known as STD, is a term used to describe more than 20 different infections that are transmitted through exchange of semen, blood, and other body fluids, or by direct contact with the infected body areas of people with STDs. They are also called venereal diseases. Mode of transmission is sexually, is vaginal intercourse, anal intercourse, oral intercourse. Non-sexually is mother to infant, and blood-sharing needles. 7 of the most common STDs are HIV, gonorrhea, syphilis, genital herpes, genital warts, and chlamydia. Human immunovirus is a causative agent is a virus. Incubation period lasts 3 to 6 months. Symptoms: initial primary infection is like flu-like illness, like you feel like flu. Asymptomatic infection is individuals who are affected has no symptoms or signs and feels well. Symptomatic infection is characterized by a wide range of symptoms lasting weeks, months, such as weight loss, night sweats, fatigue, dry coughs, diarrhea, swollen lymph nodes, memory loss, chronic yeast infection. End stage of HIV is acquired immuno syndrome, known as also AIDS. Note there is no cure for this disease. The end result is death. Gonorrhea. The causative organism is a bacterium. Incubation period lasts 1 to 14 days after onset, also known as Neisseria gonorrhea. Females, the symptoms for females are thick, yellowish discharge from the vagina, abnormal vaginal bleeding, burning during urination, swelling, itching, or pain in the genital area, lower abdominal pain. No symptoms, more than 50% are asymptomatic. For the males, you have urethral discharge. It's often purulent, meaning like you have like pus. That's what you mean by purulent. Burning during urination. No symptoms. 13.77% are asymptomatic. And this is what it looks like. This is around the lip. And this is around the head of the penis. Okay? Now, my colleague, Ms. Lois Stewart, is going to talk to you all further on syphilis.
Good day, once again, I'm student Nurse Stewart. Syphilis, the causative organism is bacteria, and there are 4 stages. It is the primary stage, secondary, latent, and the tertiary stage. With primary syphilis, there was 1 or more painless sores or lesions called a canker that appears on or around the genitals and sometimes the mouth. Cankers may not be noticed in the vagina, rectum, or cervix. It may last 1 to 5 weeks and disappear without treatment. Painless and large glands in the groin are all symptoms of the primary syphilis. Now, secondary syphilis, there's a non-itchy rash on the trunk, soles, or palms. And these are pictures of the syphilis. You can get them in, but you can see it appear in the face. This is the lips, and this is also a picture of the shaft of the penis. In latent syphilis, there are no noticeable symptoms, although secondary symptoms may reoccur. the disease may remain static or progress to tertiary stage. With tertiary syphilis, it can be structured the entire body and cause long-term effects, such as heart disease, brain disease, paralysis, blindness, or even death. And this, with the tertiary syphilis, you could have the organism in your body and may not see symptoms for 10 to 30 years after infection. Now, this is trichomoniasis. The cause of agent is protozoa. And you know what protozoa is?
That's a gone, germ.
Yeah, infectious agent. Yeah, sure. Good. And the incubation for trichomoniasis is, the incubation is 1 to 3 weeks. So what that basically means is, if you let's say today is the what? Let's say November 1st, you could track trichomoniasis. You won't see it till November 21st. Yeah. So long, that's how long it'll take to show up, as much as 3 weeks later. With females, they have a gray, yellow, or green vaginal discharge, and you can have a bad smell. Smells really bad. Itching in the genital area, pain during intercourse, burning during urination, or some females have no symptoms at all. And this is a picture of the infected area. Again, that's the lips of the vagina, and this is the shaft of the penis. Okay, now my colleague, Mackintosh, will take over the general briefing.
Today, I'm Mackintosh, and today I'll be presenting on genital herpes. Genital herpes, the causative organism is herpes simplex virus type 2. The incubation period is 2 to 21 days or longer, but as you can see, this symptom it occurs more rapidly than the two she discussed. The symptoms, initial outbreak, you'll have itching or pain at the site of the virus. Cluster or small blisters may develop. Open sores or lesion lasting an average of 7 to 21 days. Tender swollen glands in the groin area. Flu-like symptoms. You know some of the flu-like symptoms.
Cough,
Urethral discharge. You all know what that is. Like, for the males, you'll have like pre-ejaculation. And sometimes you'll have abnormal vaginal discharge. Here we have type 1. This is a cold sore. Some of you know it as night fever. This is not a STD, but this is on the penis. It's also like a cold sore in shape, and this is the vagina. Following the initial outbreak, as the sore heals, the virus retreats through the nervous tissues. Bag remain dormant until triggering factors cause it to reactivate. Recurrent outbreak, you have tingling, itching, burning, or pain down the leg before the sores appear. Usually less severe.